Is a ketogenic diet really helpful for mental health? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot on this app about using metabolic and lifestyle interventions to target root causes of mental illness. And one of the things that I've mentioned a few times on this app here is how a ketogenic diet can be used to treat multiple different psychiatric conditions, including things like bipolar disorder, schizophrenia, major depressive disorder, and more. So let's start with talking about where the idea that a ketogenic diet might be helpful for mental health comes from. So the ketogenic diet was actually originally developed in the 1920s as an intervention for treatment refractory epilepsy. We have multiple randomized controlled trials in both children and adults that this is an effective and relatively safe intervention. And if we think about it, we use a lot of seizure medications in psychiatry to treat mental health symptoms, things like Depakote or lamotrigine or carbamazepine. So it would make sense that something like a dietary intervention that helps seizures could also help mental health symptoms. And there's actually a growing body of literature showing just that. There's been studies to show improvement in major depressive disorder, in schizophrenia, in schizoaffective disorder, in bipolar disorder, in ADHD, in OCD, in Alzheimer's disease, Parkinson's disease, autism. And while we don't yet have randomized control trial level of data, there are several different randomized control trials currently underway. But why does this diet work? Why does it have an effect on mental health and or neurologic health? So a ketogenic diet is a very low carbohydrate, moderate protein, and high fat diet that essentially switches your body's fuel burning mode from carbohydrates to fat predominantly. There still is going to be some carbohydrate burning regardless. So I'm going to talk about the three things that are probably most important in terms of their potential to cause mental health symptoms. And the ketogenic diet actually addresses all three of these. So the first is going to be that of inflammation, the second is oxidative stress, and the third is insulin resistance. So when you switch from carbohydrate burning to fat burning, then you basically are bypassing the whole insulin resistance issue because you don't need insulin to burn fat for fuel. Second, the process of burning carbohydrates for fuel is going to cause more oxidative stress and inflammation, which can again contribute to these mental health symptoms. Whereas burning ketones, which is the byproduct of fat for fuel, is a much sort of cleaner, I hate to use that word, but cleaner metabolic process that has less inflammation and less oxidative stress associated with it. So if these are the things that are causing someone's mental health symptoms, if you switch the type of metabolism to something that bypasses them, you're probably going to notice improvements in symptoms. Now, there can be risks associated with this, and it's not appropriate for everyone. So definitely please do not make any major dietary changes without talking with your prescribers first. And it's also usually something that we recommend doing in addition to taking psychiatric medications, at least to start. If you have other questions about the ketogenic diet or you've tried it and you've had a positive or negative experience, I'd love to hear about it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.